This is the training for the OP30.
We'll start with a general overview of controls and then show you positioning on a patient. On your touchscreen, you have Program 1, which is Adult Pan, Program 2, which is Pedo Pan, Program 3 is Joints Only, and Program 4 is your extraoral bite wing. Programs 1 through 3 position the same, and the bite wing positions very similar. You'll notice that as you change your program, your KV changes for you as well. We automatically make that selection. If you did want to overrule it, you can simply change your patient size. The T button, you'll notice, turns everything to 0. This eliminates all the radiation. This is great for patients with high anxiety. You can show them the unit. It moves and sounds like it's taking a pan with no radiation. Once they're comfortable with it, simply touch T again. It turns all of your radiation back on. Go through positioning with them and take your pan. On the back of the unit, about 18 inches off the floor, you have a lit green on-off switch. That's simply where you turn the unit on or off. On the side of the unit, you have a light bulb button. This turns your laser lights on or off. There's 3 lights on this machine: a mid-sagittal light down the center of the patient's face, Frankfurt plane light from the infraorbital notch to the tragus, and a canine light for the maxillary canine. They turn off every 30 seconds. This light bulb just simply turns them back on. Just below that, you'll see an up and down arrow. They move the machine up or down, respectively. And on the bottom, you have a reset button. It's an arrow going 3/4 of a circle. That puts the machine and the patient in position. Lastly, below that, you have an emergency stop button. This button never needs to be pressed. However, if it is, you'll notice that an emergency stop button pops up on your touch screen. Simply turn that button clockwise, like the arrows show, and everything goes back to normal. We'll go through positioning of a patient now. What we're going to do is we're going to raise the chin rest higher than the patient can reach. Ask the patient to grab our handles. Put your left foot just below those handles and ask your patient to step up to that. That helps us get the collarbones as close to the white bar as we can. Next, have your patient look straight ahead and lower the chin rest to just below the crease in their chin. Lightly touch your patient's back. Ask them to lift their chin, pull into the machine, and set their chin down. If they're a little high, we will lower this to make them slightly more comfortable. Raise your bite stick. Ask your patient to open, come forward, and lightly close on the bite stick. And you want their teeth to fall into the grooves. Next, ask your patient if they can see the line down the center of their face. You want that line in the center of the philtrum, not the center of the nose. Noses tend to be crooked. Use your little blue tab on the side of the mirror to set this Frankfurt plane light at the bottom of the patient's eye socket. Hold the back of the patient's head lightly and ask them to tuck their chin as you lower the unit until we're touching the top of the tragus in the ear, infraorbital notch, and the tab in the ear. Lastly, ask your patient to smile big. You want that light on the maxillary canine. If it is off, you have a black dial here to adjust your patient forward or backward. Close your nasion support. Close your temple supports. Ask your patient to close their lips, swallow and hold their tongue to the roof of their mouth, and take the pan. If you're taking an extraoral bite wing, here's the one difference. We would select bite wing, and instead of dealing with our canine light, there is a black line on the white of the machine, and there is a white graded scale on the chin rest. All we are going to do is drive this chin rest backwards until the bite wing line and the black line meet. At that point, ask your patient to close their lips, swallow and hold their tongue to the roof of their mouth, and take your pan. Thank you very much. This has been your training on the OP30.